Hi, this is Dr. Saba from Aamir Dental Center. Hi everybody. Today my video is regarding implants, and I'm going to have a discussion with my expert who comes to my clinic, Dr. Aamir Bashir.
Hello everyone.
And I'll introduce Dr. Aamir Bashir because many of you must not have met him. So now he has joined Aamir Dental Center as a maxillofacial surgeon consultant, and he also will be performing certain surgeries if required in my clinic. So here, just to give you an introduction, he's a maxillofacial surgeon, and he's done many cases in trauma, reconstructive surgeries of the face, as well as treated many oral carcinomas, and he also has done many complex implant cases successfully. So he's the best person to ask certain questions to, which usually patients ask us as doctors. And today, when I talk to Dr. Aamir, I'm not going to talk to him like Dr. Saba. I'm going to talk to him like any other person who needs an implant would. And we want to give you a very clear picture of what implants are, where implants are indicated, when they are contraindicated, what kind of stuff there is now in the market, since implant has become a major it's a major rehabilitation thing, where we can give you fixed dentures even when you don't have bones. And mostly outside, the myth is that if a patient does not have bone, he cannot go for implant, but that's now proven wrong. So Dr. Aamir will be answering questions which I will be putting forward. If you need any other suggestions, if you have any other suggestions or any other questions, then you can always message us and we'll get back to you with those. So, hello Dr. Aamir. Welcome to Aamir Dental Center.
Thank you so much.
So Dr. Aamir, now today, as I introduced, we are going to talk about implants, and we are going to talk about every doubt, every myth, contraindication, indication, health issues, everything that a patient should know before he comes to the operatory and asks for an implant. So now you know that earlier the only fixed option we had was a bridge, okay, and people were very comfortable with it and they knew it. But since many years in India, implant has now come up as one of the very successful option for giving fixed teeth, even if you lose one tooth or you lose all of them, right? So I want you to tell people a little bit about implant and what is that thing actually. Because when patients come to us, I'm sorry to say that, but in layman language they say it's a screw jo aap haddi mein dalenge, and then you'll give us a crown, a tooth on it.
Yes.
So can you just shed a little more light on what exactly implant is and what medical stuff it is made up of?
So to be very honest, people do consider it in terms of a screw that we are putting inside the bone, and how important it is and what all the other things which are related to it. So basically, oral implants, you can say it's a tooth-shaped kind of an material which is made out of titanium, which definitely looks like a screw, which is used to put it inside the bone, and which functions in generally as an entire tooth for the rest of the life what patient is going to use them. So now the thing is that since you spoke of it as one of the parts of treatment, like previously people in India used to get done fixed prosthesis, but recently due to advancements in our technology, you see implants have a very long lasting life as compared to bridges. And the thing is that since it goes and gets fixed inside your bone, it functions as one of the core component of your masticatory system. So whenever if there is something people want to use a material which is more related to the tooth, like the way you wear your teeth, you just go smile, you brush and you sleep and you do stuff. So you don't worry so much about the prosthesis. So this is how it is exactly an implant is. That ideally we use, which is made of titanium material, which is very much compatible to your bone. Compatibility means that it easily goes and gets settled inside your bone. There are no such responses, very few considering terms, and it gets settled there for the rest of your time. And apart from that, if I am to talk about oral implants, it is just not that normal screw type thing what people say, which goes and gets fixed inside your bone. There are some other forms of implants too available in market, which recently we use it like long implants we can say, or which take support of your cheekbones. The good part of the recent advancement is that none of these things it happens extraorally, like bahar kabhi kuch nahi de sakte. There is no such extraoral scar. Everything happens from inside. We take support from your cheekbones. And also with recent advancement, there is a specific term which has come now in market, which is called as patient specific implants. That is that we carefully curate those specific implants based on specific patient dimensions, and we make it for them and we fix it inside.
Okay, so Dr. Aamir, now what I understood was that there is one type of implant which is a simple implant. The other one is like long implants which get fixed into your cheekbones. And the third one is a patient specific implant which is made on the dimensions of the patient's structure whenever required. So a simple implant, when is it placed, and how do you decide which kind of implant will be placed in a patient?
So to decide that if the patient needs an implant, first we also need to focus that is that patient feasible enough? Is it possible for us to place an implant? It's not necessary that every time a patient wishes, that he wants implants, he or she wants an implant, and we can go and fix it. So there are multiple factors which we should focus on before placing an implant. The first and foremost, it starts with patient's medical problems. If patient is having any medical issues like any diabetes or any other systemic problem like blood pressure, which are very commonly seen these days, or any heart issues which can have some effects based on healing, based on success of the implant. Also, we need to check inside patient's oral cavity, that is, can it be placed? Is there adequate space available? Is there adequate bone which is available? Then based on those factors, we'll decide then what kind of implant is needed. So is it a normal implant, the normal screw implant, what people say is needed, or a long implant which is needed, or something which can be called as the patient specific implant which is needed. So all these factors, they do play a very important role. So without those factors, it is never possible for us to place an implant. So it is always recommended for everyone to first go through all these diagnostic steps and then come on to implants. That can it be possible? Because just placing an implant and sending a patient home is not success. The success is that the patient is using it for rest of his or her life, which he or she likes it and continues it for rest of his time. I guess that is what a treatment success should be.
So it's like the first question, why did you lose your tooth first? That is the first question.
True, very true.
And then the doctor will then decide that whether the reason for losing the tooth, now how to rehabilitate that tooth back. Patient can lose a tooth due to a systemic disease, patient can lose a tooth because he fell or underwent a trauma or got caries or whatever. So those things also from the initial beginning process, that why did you lose your tooth in the first place, a doctor has to see multiple things and then decide which system of implant placement will be feasible for you and what will work for you for better. Like certain implants, when they are placed, obviously there are guarded prognosis for that. Once we place it, we know that it's a guarded implant. These are certain conditions in your mouth, how you bite, how your teeth are, how the rest of your teeth are, what is your gum health, and everything that matters, right, doctor? Okay, so now we will just share certain snapshots of implants, like whatever simple implant is, then a PSI is, and a zygomatic. So we'll share it immediately after this.